Okay. Welcome back. Damage to the nerves outside of the brain and spinal cord can cause peripheral neuropathy. According to the Vertical Neuropathy out of Fort Worth, more than 3 million people suffer from this painful condition every year. Dr. Trevor Adams, DC, is the founder and joins us to talk about effective treatments. Good morning, doctor. It's so good to have you here.
Yes, thanks
really
for having
appreciate
me.
this information. It's a problem for a lot of people. Johns Hopkins University says there are 100 types of peripheral neuropathy. I wouldn't have dreamed that.
Yeah, I know, and it sounds daunting, and there really is, but each one has its own set of symptoms and prognosis, and actually the most common form of neuropathy is diabetic neuropathy, which is consistently high blood sugar levels, and so that can result a lot of times in pain in the feet and swelling in the feet and ankles, and so that's one of the things that we see, and like I said, each one has its own set of symptoms, and so it's really determining what type of neuropathy there is before we determine treatment.
So out of those 100, diabetic neuropathy is one. What are a couple of other common ones you see?
Yeah, a couple ones we see, motor neuropathy, which is damage to the nerve fibers that control muscles and movement. Sensory neuropathy is another one that controls a lot of the sensations we feel, so light touch, temperature change, and even just what we feel as in pain in general. Another is actually autonomic nervous system neuropathy, which is damage to the nerve fibers that control a lot of the things we don't consciously think about, like breathing and our heart beating, and that can be a pretty serious form of neuropathy.
Interesting. So what has been used to treat neuropathy pain and discomfort?
Yeah, so typically we see patients come in that have taken gabapentin, Cymbalta, Lyrica, and even at times we'll see injections, lidocaine injections, and even lidocaine patches used to help control this. The problem is it doesn't really fix the issue. It only covers up the pain, and that's what we see a lot of patients are frustrated with.
Yeah, I was in fact talking to a friend the other day about having neuropathy after cancer.
Yes.
And some treatments, and he was talking about the problems of just covering up the symptoms. So the question is, vertical neuropathy's treatments are different. How so?
Yeah, and we are very different. We don't do any drugs or pills or medications, and definitely no surgery or injections. What's nice is we actually use electrical cell stimulation to help regenerate the nerves and regenerate the blood vessels from a lot of those nerve fibers that have died off. And once we regenerate the tissue, we start to see the sensation come back, but also not have to use the medications as well.
Well, it's terrific.
Yes.
The things that you can do now that you used to not be able to do in terms of medicine and helping people.
Yes.
It's just great. Okay, so you have a $49 neuropathy special offer for our viewers this morning. Can you talk about that a little bit?
Absolutely.
What this gives to viewers and the value that it is?
Yeah, well, and we want to give an opportunity for those that do struggle with neuropathy to get relief from that. And so this includes a full consultation and examination with me, and then a report of findings. And that's the thing, we're going to calculate the exact percentage of sensory loss that somebody may have, and then also come up with an individualized treatment plan for them. There is no cookie cutter approach. And so we want to get the treatment plan for them, and then also help them towards getting pain-free.
So real quick, before you get away, how helpful have you seen this be to patients who have been suffering?
We've seen it help a lot of people, and that's what I get really excited about, just as you've probably seen, just because most people are looking to just get out of having to take the medications to cover up the pain, but also do something to address more of the root cause. And that's where I've seen we've been able to fit into the healthcare model by helping people get to being pain-free.
Good for you.
Yeah,
You're doing some good stuff. Thanks so much for being with us this morning.
Thanks for having us.
Okay, if you or someone you know suffers from neuropathy, vertical neuropathy, wants you to call the number on your screen now. Here's the number to call. I'm going to give you a second to get your pen. 817-663 HEAL. Again, it's 817-663-4325. You can also visit, of course, you can go on the web and visit verticalneuropathy.com for a lot more information. We'll be back.